Good morning, ladies. How are you today? I hope you all fine and with good health. My name is Raneem and welcome to our presentation today. Today, we will talk about a rare case happened to some people because they face psychological shocks in their life. It's called syndromes. At the end of presentation, you will know the meaning of syndromes, examples of syndromes, the reasons of syndromes. Syndromes. It's a type of negative behavior, mental state that is typical of person in particular situation. To make it more clear, let's take some examples. What do you guys think about these syndromes? Okay, so let's see what it is. It's a condition characterized by bouts of laughter and crying. It becomes more famous after the Joker's movie. To get all this straight, let's see now part of his movie to clarify his case. As we can see now, he's laughing combined between laughing and crying. It may happen due to stroke or Alzheimer's disease. It may cause embarrassment and depression. That was all my information about this case, and I will leave you now for the rest.
Hi everyone, my name is Rasha. I will talk about Cotard syndrome. Cotard syndrome is one of the most complex known syndromes in which its owner suffers from a neurological and psychological disorder and often afflicts schizophrenics and patients with bipolar disorder, and it may be associated with injuries or brain tumors and depressive episodes, and its effects women more frequently. The patient suffers from a real mental disorder in which the patient imagines themselves running like they died or that they aren't present. The disease has 3 stages. The first stage, the patient shows signs of depression, severe anxiety, and an increased fear of contracting any disease. The second stage, the patient suffers from real disease symptoms such as delusion that he is died or immortal. The third stage, in which the patient suffers from a surface depression as a result of an emotional defect. The treatment is still unknown, so only symptoms are treated. Treatment includes antidepressants in addition to electrical shock therapy.
Hey everyone, I'm Ilmaha and I will talk about Tourette syndrome. I hope you enjoy. Tourette syndrome is a condition that causes a person to make involuntary sound and movement called tics. They usually start during childhood, but the tics and other symptoms usually improve after several years and sometimes go away completely. There is no cure for the Tourette syndrome, but treatment can help manage symptoms. People with the Tourette syndrome may also have possessive compulsive disorder, OCD, attention deficit hyperactivity disorder, ADHD, or learning difficulties. Symptoms of Tourette. Tics are the main symptoms of Tourette syndrome. They usually appear in childhood between the age of 5 and 9. People with the Tourette syndrome may have both physical and vocal tics. Example of physical tics: 1. Blinking, 2. Eye rolling, 3. grimacing, 4. Shoulder shrugging, 5. Jerking of the head or other limbs, 6. Jumping, 7. Twirling, 8. Touching objects and other people. Example of a vocal tics: 1. Grunting, 2. Throat clearing, 3. Whistling, 4. Coughing, 5. Tongue clicking, 6. Animal sounds, saying random words and phrases, repeating a sound, word or phrases, swearing. Tics are not usually harmful to a person's overall health, but physical tics, such as a jerking of the head, can be painful. Tics can be worse on some days than others, maybe worse during periods of 1. Stress, 2. Anxiety, 3. Tenderness. Children with the TART syndrome may be at risk of bullying because their tics may single them out.
Hello everyone, my name is Minar Abdullah. Today we want to talk about the foreign accent syndrome. Let's go.
It wasn't until I was in the ambulance on the way to the hospital she actually said, "Are you aware of the way you're speaking?" And I said, "Oh,
As we saw in the video, Sarah has foreign accent syndrome as a result of her brain injury, so she speaks English with a Chinese accent. The foreign accent syndrome is a rare health condition that includes speech production, and it usually occurs as a side effect of a serious brain injury, such as stroke or acute brain injury. It must be made clear that a person with this syndrome did not suddenly acquire a foreign language. What happens is that she speaks her native language, but with the accent make the listeners think she is foreign or controversial. And people with foreign accent syndrome may be tempted to speak real foreign language with their own dialect. Symptoms of foreign syndromes include damage to the nerve ganglia on the right side of the brain, speech disturbances, marked change in tone of voice, and severe headache. There is no specific treatment for the syndrome, and we usually begin to treat the main cause, and periodic imaging of the brain can help us to understand the healing process. Some treatments include vocal training, specific exercise aimed at vocalizing the sound in a natural tone. So thank you for listening. I hope you like it.